Hereditary angioedema, or HAE, is a rare, non-allergic form of angioedema, or swelling. In most cases, HAE is inherited, but around 25% of those diagnosed are the first in their family to have HAE. HAE attacks may be painful, debilitating, and even life-threatening. A variety of situations can trigger an HAE attack, such as fatigue, stress, sickness, hormonal changes, and more. But the root cause of HAE is missing or dysfunctional C1 esterase inhibitor, also known as C1-INH. Normally, C1-INH regulates inflammation by keeping the production of pro-inflammatory complexes in check. But people with HAE have low levels of working C1-INH, which prevents the regulation of pro-inflammatory complexes, leading to unpredictable attacks of angioedema or swelling. Let's take a closer look at the inflammatory process and the role of C1-INH. C1 esterase inhibitors have been used and studied in HAE for over 35 years. They impact 4 inflammatory cascades, including the KALLIKREIN-KININ cascade, which has a powerful influence on the inflammatory process. Here's how the latter part of the KALLIKREIN-KININ cascade works. When the body doesn't have enough functional C1-INH, there's a greater potential for an unregulated pro-inflammatory complex, called prekallikrein high molecular weight kininogen, to undergo a structural change to become a kallikrein complex. Part of this complex is then cleaved to release bradykinin, which goes unregulated. Bradykinin is a key inflammatory mediator of vascular permeability that binds to receptors on cells lining the inside of blood vessels. Unregulated bradykinin causes the cells to lose their attachment to each other, allowing fluids and proteins to leak out into the surrounding tissue. This can result in an HAE attack. Attacks can happen anywhere in the body, including the face, throat, abdomen, and limbs. So how can we prevent all this from happening? Haegarda. Haegarda is a C1 esterase inhibitor. Haegarda addresses the root cause of HAE by replacing missing or dysfunctional C1-INH, thereby regulating the kallikrein-kinin system. C1-INH inhibits prekallikrein and kallikrein. This regulates the production of bradykinin, which prevents unnecessary and unpredictable episodes of vascular permeability and can help prevent HAE attacks from happening in the first place. When self-administered subcutaneously twice weekly, prophylaxis with Haegarda builds and maintains steady levels of functioning C1-INH, which allows the body to regulate inflammation in the same way it does naturally and can prevent HAE attacks. The 2017 World Allergy Organization treatment guidelines for HAE recommend the use of C1-INH for first-line, long-term prophylaxis. Haegarda is the only subcutaneous C1-INH therapy indicated for the prevention of HAE attacks. In the pivotal clinical study, Haegarda reduced HAE attacks by 95%, and people taking Haegarda reduced their rescue medication use by over 99%. And with weight-based dosing, patients receive an individualized amount of C1-INH based on their body weight. The most common adverse reactions occurring in greater than 4% of patients while taking Haegarda were injection site reactions, nasopharyngitis, hypersensitivity, and dizziness. These patients were treated with 40 IUs per kilogram and 60 IUs per kilogram. Help patients break free from HAE with Haegarda. Important safety information. Haegarda C1 esterase inhibitor subcutaneous human is a plasma-derived concentrate of C1 esterase inhibitor, C1-INH, indicated for routine prophylaxis to prevent hereditary angioedema, HAE, attacks in adolescent and adult patients. Haegarda is for subcutaneous use after reconstitution only. Haegarda is contraindicated in patients with a history of life-threatening hypersensitivity reactions, including anaphylaxis, to C1-INH preparations or their excipients. Severe hypersensitivity reactions to Haegarda could occur. In such cases, discontinue administration and institute appropriate treatment. Epinephrine should be immediately available to treat hypersensitivity reactions. At the recommended subcutaneous dose of Haegarda, no causal relationship to thromboembolic events, TEs, has been established. However, TEs have been reported with intravenous administration of C1-INH products, usually at high doses. In clinical trials, adverse reactions observed in more than 4% of subjects treated with Haegarda were injection site reactions, hypersensitivity, nasopharyngitis, and dizziness. Haegarda is derived from human plasma. The risk of transmission of infectious agents, including viruses and theoretically the Creutzfeldt-Jakob disease, CJD, agent, and its variant, VCJD, cannot be completely eliminated. Please see full prescribing information for Haegarda.